The government now says Kenyans should wear face masks whenever they visit supermarkets or use public transport. But the new guidelines come amid a shortage of masks and the emergence of low-quality ones whose effectiveness is not guaranteed. Enock Sikolia now reports on the little piece of cloth that can save your life or put you in greater danger.
The mask has become the latest weapon to be added to the growing arsenal that is to help in the fight against a pandemic that has occasioned a global shutdown. Since the beginning of the global coronavirus pandemic, Kenyans had been told by the government not to wear masks unless they are sick, caring for a sick person who is unable to wear one, or working in healthcare. Numerous reasons were given that they don't offer significant protection, and most of all, that there aren't enough masks and respirators for healthcare workers who desperately need them. So leave the masks to them. Now, there are big changes to that policy.
But we are not saying that people should be sitting around waiting, for masks to come to them. Wananchis now have been given freedom, to make them, and we have said these things should be made as cheaply as possible.
There is one big reason for the change. There is increasing evidence that the virus can spread by pre-symptomatic and asymptomatic carriers.
With the number of coronavirus cases on the rise in the country, the government advised Kenyans using public transport to wear face masks. That has created demand for the now precious commodity. And with it, different types, sizes, shapes, colors of these face masks have emerged.
Going forward, we will expect, for example, that when the supermarkets are giving masks as people enter, and the experience we have seen over the last couple of days is that people are not even waiting to be given these masks. They are acquiring them for themselves because it is your own safety.
That means one thing. The era of the homemade masks and face coverings is upon us. Alex Omondi arrived in Nairobi's Central Business District with hope of getting several masks for himself and his family. But as we continued to discuss the merits and demerits of what he had acquired from the street, Omondi spotted what he had been searching for all along. The surgical mask the government has been displaying in the media. But then he's disappointed that the mask is a single-use one.
When the price can be lowered, kila mtu itakuwa naweza ku afford kwa sababu tunaambiwa haifai kutumia more than 8 hours. Inafaa utumie tu for a certain period. Alafu unatumia unanunua ingine.
If one is in close contact with someone infected, a mask cuts the chance of the disease being passed on. They are effective at capturing droplets, which is the main transmission route of coronavirus. But the primary benefit of covering your nose and mouth is that you protect others. So if one is wearing a mask and someone sneezes on him or her, will the mask offer some protection? Dr. Kevin Guringa says yes, but he maintains that only happens if you use the mask properly and don't touch it with your hands afterwards. He takes a boda operator on how to effectively wear a mask.
Ipeleke hii, ingie, ikaribie kwa mapua, ipande ya juu, hivyo. Baada ya hapo, ningependa uchukue hii strap uweke kwa mapua, hivyo. Then ushike pande ya chini hapa, vuta chini, then chukua hii pande ingine, eka kwa shukisha hii, ifunge ndevu kabisa, iende chini kabisa, lakini hii pande ya juu, inafaa kufunga Sasa finyilia hii waya vizuri na vidole mbili, finyilia vizuri, isil kabisa hivyo. Then hii iende chini hivyo. Kila wakati unavaa, mapua ifai kuwa nje ya mask, na pia hii pande ya chini inafaa iende chini kabisa.
When properly worn, droplets containing coronavirus from cough or sneeze would hit your mask instead of your mouth and nose. Good news. But the next step is taking off the mask without touching the front of it.
Unaweka kwa mkono, unafanya hivi. Baada ya hapo, sasa unashika hizi strips. Shika hizo strips sasa. Zote mbili pamoja. Ishikilia hapo kando. Toa pole. Then unairusha kwa dust.
If one touches the front of the mask, whatever was coughed or sneezed on it is now on his or her hands. But medical masks cannot protect one against coronavirus when used alone. They must be combined with proper hand hygiene. With the shortage of medical masks combined with increased demand has led to the rise of homemade masks. They dot Nairobi's landscape. But how effective are they?
Yesterday, the CDC updated their current guidelines on surgical and N95 mask. And they stated it clearly that if you are able to make a homemade solution, which has probably 100% cotton, it's as effective as wearing a surgical mask. If not, any clothing that is well designed and looks like a mask, remember what you're trying to do is you're trying to prevent large droplets from contaminating the environment, but also from contaminating the people around you.
In the CBD, we met a couple that had donned face shields.
My nose is covered, my mouth is also covered, and I don't have to pull it up, down all the time. You just wear it once and it stays put.
The face shields are really ineffective, they are not correct, and actually put you at a greater risk of being contaminated.
Enock Sikolia, Citizen TV.